Hey there, this is Dr. Paul Gundian of Restore in 24, and this is the first of many case studies that we're going to start doing. Just over some cases that we did, some wonderful patients that we have in here, and some great transformations. So we're first going to start with a gentleman, Mr. Brad. He is 45 years old, and he's actually a firefighter. And he came in like this. So he had a lot of missing teeth and a lot of teeth that were broken down to the gum line. So at this point, he's missing his posterior support, meaning he doesn't really have a way of chewing properly. He doesn't wear partial. He's not really able to eat the foods he wants, and he doesn't smile. He's pretty self-conscious about his smile during this time because he doesn't have any front teeth to smile with either. So he presented like this to us, and his main complaint was, I just want to be able to chew again. I want to be able to smile again and get my self-esteem back. All right. So he decided he wanted to do the case with us, and he wanted to do both upper and lower, which they both needed. At this point, we just needed to start completely fresh. So as you can see here, we took some side view photos. So we took some photos from frontal photos and some retracted photos. And here you can just kind of see just the extent of some of the broken teeth. So none of these you can put crowns on once they have this amount of decay. So at this point, your only options are really just taking them out and doing dentures or something like a snap-in, or obviously the best choice would be something like Restore in 24. Give them something fixed, something that will be the most natural looking and also the most natural feeling. So after we decided what we're gonna do, we ended up planning his case out. And we first start, when we plan the case after the teeth, is we look at his x-rays. So we're trying to see, what does the bone look like overall? So we have CTs, but we also have this panoramic x-ray, and this panoramic x-ray really shows us where we can place those implants and what options we have in doing these implants. Some people get 4 implants, and a lot of that's just dependent on their natural anatomy. And so basically, when I originally looked at his x-ray and his CT, I saw that he had plenty of bone height and plenty of bone width, but we were kind of constricted. We didn't have the sinuses. This area where the sinuses are were taken away from us being able to place implants. So we really could only place implants in this case here, tilted in front of the sinus, here in front of the sinus, and then 2 down the center. So 4 for nice, evenly spaced, easy to clean implants. Typically, I like to get 6 if I can, but his bone back here, we call the pterygoid bone, and back here, it's a little thin. And we were able to actually get the implants far back enough looking at this case by tilting them that we didn't need any more implants than 4 on the upper. Now on the lower, I always plan for 6 as well. And thankfully he has pretty low nerves here, so we actually can get an implant in the back here, and then typically what I do is then I also tilt. Sometimes I go straight up and down, right down the center. So 6 was the plan on the lower. So after we get an idea of what we're gonna do in terms of the overall, how many implants we're gonna place, spacing, and we just know what the overall teeth look like to start, then we start planning and trying to figure out what do we want these teeth to look like. So we take a bunch of scans downstairs and we send these up to our in-house lab, and I work with our lab techs upstairs, and we just do a mock-up and try to get an idea of where do we want to put these teeth. And so we're trying to make sure that they have good aesthetics and good looks, but we also want to make sure that there's good function, because sometimes you have to do a trade-off of some extent based on someone's bite. So on his, everything's pretty straightforward. So when I'm looking at this, we wanted to give him some nice straight teeth with the midline down the middle where the front teeth meet up. And we want to follow his lower lip with this smile. So his upper teeth are slightly following the lower lip for his smile. And then on the right side, we can see after we selectively extract teeth on the computer where we want to put the teeth. And so right here, we have all of those images. And then he comes in, we do the procedure. Everything is nice and straightforward, no issues. So we actually place 4 implants in the front like it was planned. So 2 tilted right on the corner in front of the sinuses, and then 2 down the center. And then just like we planned, 6 on the lower. Sometimes I place my implants straight up and down rather than tilted on the lower. It really just depends on the bone quality and just of where I'm working with. If the case calls for going straight up and down, I go straight up and down. And sometimes just based on the bone quality at the certain area I'm going, I'll go straight up and down. And also on him, since I did have to contour the bone quite a bit, since I was already at the levels of the sinuses right here and right here, I just added some bone inside those sinuses. And what that does for us is that if there was ever, God forbid, something to happen to these implants up or up here, I know that we have a backup plan with the bone here and back here. So it was one of those things that we were already at the level of the sinuses, and it seemed like there was a good chance we were going to need them to get the teeth all the way backwards, but we actually were kind of lucky enough in which these implants were far back enough that these are just more or less spare tires for the future, right? And then here's our before and after. So everything went really well with him. Surgery went well. He was comfortable the whole time. Got him in those set of healing teeth the next day, and then after 3 months, we got him fit for his permanence. And as you can see, they fit his face really well. The shape's really nice, and he's happy. He's able to eat whatever he wants, and he can move on with his normal life and feel confident again.